Okay, guys, Timmy coming at you again. And today, what I'm going to try to do is I'm going to try to explain to you the process of inflammation. The fact of the matter is that what many people believe, many doctors, many scientists believe, is that inflammation is the basically the starting point for all disease. They believe that cancer is a result of an inflammatory process. So, inflammation is one of the basic functions of your immune system. It's kind of rudimentary, right? You got other more sophisticated ways to protect you, white blood cells, antibodies, all that good stuff. But what I want to talk about today is how the body produces inflammation, and then some of the medications that are used to treat inflammation, and just to give you an idea of how they work, all right? So again, remember, the primary function of the immune system is to produce inflammation. And when it produces that inflammatory response, it's protecting you. Now, we've gone over the immune system, but I just want to review a couple of things, all right? Just a couple of terms you're gonna be hearing, right? Antigen. An antigen is anything that produces an immune response. So it could be a little small protein floating around in your blood, or it could be a big old bad bacteria, right? So anything that produces an immune response, antigen. Pathogen, by definition, really is an antigen, but the difference is that this antigen can produce disease, hence the pathogen. And we know that the two big antigens or pathogens that nurses tend to deal with are viruses and bacteria. And when you take microbiology, you'll learn all about that. The other one I want to talk to you about real quick is an allergen. An allergen is an antigen, and basically what you get is an overreactive immune system. So the immune system's getting this exaggerated response to something that it shouldn't do it, right? So that's one time your body does stuff that doesn't make sense. Now, you've gone over the immune system. You understand its function. You understand some of the ideas and functions of white blood cells. What I want to do now is just get a little more specific about some of the types of cells that are floating around your tissues and blood, and some of the chemicals that they release and their function, because that has a lot to do with why particular drugs are given for particular inflammatory reactions. So number one, I want to talk to you about these guys called macrophages. So macrophages are basically, they're kind of like the guardians of the gate. So they're placed in tissues around blood vessels, and their job is, if anyone tries to break the barrier, break that level of protection, macrophage will jack them up. They'll attack them and they'll start eating them up. And when those macrophages do that, they release chemicals that call on other cells of the immune system. So macrophages are all over your body. They're ready to go anytime one of the barriers to potential infection is breached. Let me give you an example, right? You get stabbed with a broomstick. I'll show you that in a minute. Well, you've broken the best barrier protection you have, and that's your skin. So macrophage, any bacteria that tries to get in, macrophages are going to go and attack them. And I'll show you that in a minute. And then when they do start attacking these guys, these bad guys, these bacteria, then they're going to release chemicals that do a couple of other things. One of the things those chemicals do is call on other cells of the immune system. And that's very important to remember, right? Then you got some basic chemicals. There's a bunch of others, but I just want to cover these. Now watch. Damaged cells, your damaged cells, right? When you lyse the cell membrane, when you break the cell membrane, it releases a chemical called bradykinin, right? Bradykinin, again, are these cell signalers, right? They signal other things to happen. And one of the things that these bradykinin signal are these mast cells. And mast cells are kind of like macrophage, but mast cells don't do anything until they're signaled. And this is really important. Mast cells in your surrounding tissue, they contain a chemical called histamine. Now, I'm sure you've heard of histamine. If you haven't, you probably have heard of antihistamines. And the function of bradykinins is to stimulate mast cells to release the chemical called histamine. This is really important, really important. And I'm going to put this all together for you in a little video, in just a minute. Now look, watch. You damage yourself. Somebody, I don't know, popped you in the nose, right? Got in a fight, somebody popped you in the nose, right? You damage some tissue. Hopefully you damage some of the other guy's tissue. When you damage the tissue, what do the damaged cells release? They release bradykinins. What's the function of bradykinins? To stimulate mast cells in the area to release histamine. And this is what histamines do when they're released. They cause local arterial vasodilation. That means, watch it, arteries that were this big now become this big. And they punch holes in the capillaries that are supplying those cells. And I'll explain that in a little bit, right? Very important that you understand that, right? Local arterial vasodilation, right? If the arteries dilate to an area, more arterial blood is going to go to that area. So if you were blood, which hole would you rather go through? A or 2? Hopefully you said 2, right? So arterial blood always takes, the majority of it will take the path of least resistance. And the larger the diameter of an artery, the less resistance to blood flow. So the vast majority of that blood is going to go to those dilated arteries. Where are those dilated arteries? In the damaged area, right? What caused the arteries to dilate? The release of histamines, because you damage cells, right? So we know that arterial blood, number 1, is red. Number 2, it's warmer than venous blood, right? It's redder because it's got more oxygen. So when you get inflammation, what does the area become? It becomes red and warm. So let's look at that real quick. And I made up a little goofy drawing here, I guess. Now look, what did I tell you? How do white blood cells know where the affection or damaged tissue is located in the body? The answer is they really don't. But what they do is they take advantage of physics. And where are white blood cells? Okay, hold up. I'm going to hope right now that you said in the blood. That's why they're called white blood cells, right? White blood cells, right, kill bad stuff. You got to get more white blood cells to that area because somebody socked you in the nose. That's those white blood cells circulating in that arterial blood. It's always going to take the path of least resistance. What made the arteries dilate? Well, one of the big things that made them dilate is the release of histamines. What caused the release of histamines? Well, you damage your cells because you got popped in the nose, right? You had some tissue trauma. And that's going to release bradykinins from inside those cells that are now jacked up. And bradykinins stimulate mast cells to release histamine. What do histamines do? They cause local arterial vasodilation. So the white blood cells that are in there are now going to take the path of least resistance. So here we go, right? You got your little heart. And what happens? These are white blood cells. See, I wrote white blood cells. This is healthy tissue. This is your damaged tissue, your jacked up nose. What happens? You got popped in it. You're going to get the release of histamines from mast cells, right? What do histamines do to the arteries? They dilate the arteries. So when your little left ventricle contracts and sends that nice red blood, in this case it's yellow, down to the cells of the body, along with those white blood cells, the vast majority of that nice red warm blood with white blood cells is going to go to that damaged area. So let's look for a minute. All right, here's 2 examples of inflammation. This finger is really jacked up. Don't know what that is. Looks like a pregnant worm. Anyways, this guy, I don't know, looks like he got bit by something maybe. If he would have jacked up his ankle real bad, his foot would have been swollen too by gravity. But I digress. So both of these examples, there are 2 examples of inflammation. All right. So let me put it together for you in a little video inside a video, and then I'm going to talk to you about another chemical that's important. All right. Now, this is the best video I can find on the subject that simplifies it. So I'm going to have to draw a few things, right, with my handy dandy drawer. These guys are, we'll call them macro. These are macrophage. How do you spell it? Yeah, I got it. These are macrophage. What are these guys? These guys are mast cells. And what do mast cells contain? They contain the chemical histamine. All right. Now, in this animation, what's happening, as you can see in the upper right-hand corner, a broomstick was stabbed into you. And remember that the best protection you have against infection is intact skin. So remember, you got these macrophage here, and then you have the blood vessel, the arterial, and these things, which look like little pictures of the earth from a far distance, these are white blood cells, and specifically they're neutral. Jesus. Hang on. Just got done watching a Packer game in the snow. All right, hang on. These guys are you know what? These guys are neutrophils. You can spell that. All right. Where are they? They're in the blood. Where's the bad stuff potentially going to be, like in a puncture wound, right? The bad stuff, the bacteria, is going to be in this area. So let's watch the video for a second, then I'm hopefully put it all together for you. Here you go. All right, bam. Look, somebody stabbed you with a broom handle. Not very nice, right? These little things that look like Tic Tacs, these are bacteria. So what happens when there's bacteria? Well, macrophage, right? They determine that that bacteria isn't you. Well, how did they determine that? The answer is that your cells of your body, we'll call it a U cell, right? Your cells have a group of proteins on it called the major histocompatibility complex. The major histocompatibility complex, and it's very complex. I'm just going to try to simplify it for you. The major histocompatibility complex allows the cells of the immune system to recognize you. If it has the major histocompatibility complex on it, your immune system shouldn't attack it. What don't these bacteria have? The major histocompatibility complex. So what are the macrophages they're going to do? They're going to go and they're going to eat that bacteria. Num, 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 num. So when the macrophage eat the bacteria, they get turned on. They're activated. And what the macrophage do is they release chemicals called bradykinin. Bradykinin have a lot of functions, but the function I want you to know is that bradykinin will stimulate mast cells to release histamine. And what do histamines do? Well, number one, they cause massive arterial vasodilation in the area of damage. In this case, you got stabbed with a broomstick. The second thing they do is they will punch holes in the capillary. That's important. All right. So that means the capillaries become more leaky. So let's watch this. Let's watch this play out a little bit. All right. I'm saving some smart notebook. All right. I really hate this computer, by the way, just so you know. Okay, so watch. Not shown in this video, the mass are the macrophage. The macrophage going to eat these guys, right? The little tic tacs. And then the mast cells, they're going to release histamine. Boom. What does histamine do? It causes local arterial vasodilation, and then the capillaries get holes punched in it. What does that do? What that does is that draws the white blood cells that normally circulate in the middle of the vessel, because fluid is leaking out of this porous capillary. The white blood cells that used to be flowing in the middle of the capillary or in the blood vessel now come closer to the edges. And when they get to the edges, they actually grab on to these little proteins that were created. And I'm not going to go into that. So when they grab onto these little proteins, the white blood cell has the ability to squeeze through the cracks created by histamine. And it allows the white blood cell to get out into the interstitial space. Now, the reason that area gets swollen is because the capillaries became leaky and fluid from the capillary begins to leak into the interstitial space. That also aids in getting the white blood cell out of the blood and to digest these tic tacs. So let's review, right? When you have inflammation, number one, the area becomes red. Number two, that's a 2. It becomes warm. Why? Because histamines were released, they cause the arteries to dilate, and more arterial blood with its associated white blood cells are going to go to that area. So it becomes red and warm. The histamines also cause leaking of the capillary. So that area becomes red, warm, and swollen. Classic inflammation. Now, watch. The macrophages are kind of, they just clean up the local area. What you need is some heavy hitters. And the heavy hitters are the white blood cells, in particular the neutrophils. They're the first guys to arrive on the scene. So the little holes that were punched in it by the histamine, that's going to cause the white blood cell to be able to squeeze through that area, and then the fluid leaks out and the white blood cells squeeze through those little cracks. And white blood cells can move. It's called diapedesis, which I personally think would be a great name for a rock group, but I digress. Now, this is the important piece. When these white blood cells, when these neutrophils attack these little bacteria, and in this video, they appeared to be mint tic tacs. But anyways, when they attack and destroy this area, these white blood cells release chemicals. One of the big chemicals that they release is a chemical called prostaglandins. Now, prostaglandins do several things. Number one, they increase inflammation. They make it last longer. Number two, they stimulate pain receptors. Those are called nociceptors. So the amount of tissue damage or the severity of the infection will lead to a greater inflammatory response. So the greater the inflammatory response, in most cases, the greater the amount of pain. So remember that pain is diagnostic. Pain tells you that there's something wrong, right? The other thing that prostaglandins do, and this is important, is they produce fever. Now, so you better know about prostaglandins, right? Histamines, bradykinin. So by increasing inflammation, that's also going to cause more arterial vasodilation, so more white blood cells can come to the area. So all of these chemicals that are being released, right, collectively are called cytokines. Cytokines, by their name, cyte, movement, cell movement, is the whole purpose is these white blood cells are attracted to these chemicals so that they know where the bad guys are. They don't have eyes, right? They're looking for stuff that isn't you and that doesn't have the major histocompatibility complex. So a big collection of pus is a collection of dead tissue and white blood cells. Now, we talked about prostaglandins. Now look, prostaglandins, what do they do? Right? Let's review that. And you should know this. Number one, they increase inflammation. Right? Number two, they produce pain. Right? So when you have a lot of prostaglandins around due to damaged tissue or infection, you're going to have pain in that area. And number three, they produce a fever. Now, watch. You should remember from A&P where the part of the brain that controls body temperature, and that's the hypothalamus. So, watch. You got prostaglandins in your blood. Why do you get prostaglandins in your blood? Well, you got an infection, right? And if the infection is bad enough and enough prostaglandins get released, then these prostaglandins are going to circulate in the blood. And you're not going to believe this. I find it hard to believe that on your hypothalamus, you got prostaglandin receptors. Let me cut it out. And what's your normal body temperature? Well, 98.6. Why is it 98.6? That's because your body works best at 98.6. Now you got prostaglandins around because you got a bad infection. And when these prostaglandins bind to prostaglandin receptors in the hypothalamus, it causes the hypothalamus to reset the thermostat to say, I don't know, 103. Now you got a fever. What's the point of getting a fever? Well, two things. Well, a lot of things, but number one is white blood cells work better. They kill stuff better at higher temperatures, right? They work better at higher temps. And number two, bacteria grow slower at higher temps. So the good guys work better. The bad guys grow slower, right? Bacteria grow slower at higher temperatures. So all in all, that's a good thing. That's what you want. So watch. How do you know you're going to get sick? How do you know you're going to get a fever? Well, watch. What was your original starting point? Your original starting point was 98.6. So you got to get your core body temperature up to 103. So what happens? All of the arteries that supply your non-essential parts of your body, arms and legs, they'll constrict and rush all of that arterial blood as much as it can, other than that to the infection, to the core to try to warm up that blood to raise your body temperature. If that ain't enough, then you'll start to shiver because contracting muscle will produce heat to get that core body temperature up to where you need it. So now let's go back here. Watch. Prostaglandins did a lot of things, right? Prostaglandins are produced, right? Prostaglandins are produced by white blood cells. Number two, they're also produced by the brain. Now, watch. There are drugs out there like aspirin. Yes. Jeez. Well, you know how to spell it. Having a rough day. Whoop. In this computer, just killing me. Aspirin, abbreviated ASA, and ibuprofen. Both of these prevent the synthesis of prostaglandins by white blood cells. What did prostaglandins do? They increased inflammation. They increased pain. They stimulated nociceptors, and they increased your body temperature. They gave you a fever. Aspirin's not used as much. But if you got a nasty infection, right, and you got fever, they will give you ibuprofen because ibuprofen works as an anti-inflammatory, an analgesic, and an antipyretic because all three of those things are largely mediated by the chemical prostaglandins. And ibuprofen inhibits the synthesis of prostaglandins by white blood cells. Now, where do you sense pain? Well, you sense pain in your brain. So when you have fever or you have pain, your brain begins to increase the synthesis of prostaglandins. There's a drug out there you probably heard of called acetaminophen or Tylenol. Tylenol works centrally in the brain. So it works to prevent the synthesis of prostaglandins by the brain. And the synthesis of prostaglandins by the brain can cause fever, right? So acetaminophen can be given if you prevent the synthesis of prostaglandins, you can lower the fever and as pain. So Tylenol, because it works centrally, can be used as an antipyretic, right? Can reduce your fever, and it can reduce pain, so it can be an analgesic. But Tylenol is not an anti-inflammatory. Why? Because inflammation occurs at the site of injury. That's why you can't use Tylenol as an anti-inflammatory. And watch. Ibuprofen and aspirin, although they're anti-inflammatories, they also interfere with the clotting mechanism, right? They make your blood more difficult to clot. And if you just had surgery and you're on an anticoagulant, then you don't want to be taking another drug. Otherwise, they can't control the rate at which you bleed. That's why after surgery, they give you Tylenol for the pain. And probably, a little morphine in there too. All right, so I hope that made a little sense. That's the process of inflammation. And then a little bit on how ibuprofen, aspirin, and Tylenol work. And in nursing programs and the NCLEX, they love asking questions about that, right? Is Tylenol an anti-inflammatory? And you're going to say no because it acts centrally, right? Okay, I hope that helped.